increase in the pressure in the pulmonary artery, and what's called pulmonary hypertension, which cause dyspnea.
Yes.
Dyspnea or shortness of breath.
Shortness of breath, yes. The person cannot breathe at ease.
Yes. Another issue is change in the blood composition of increasing platelet count, which is responsible for coagulation of the blood, or increasing blood fibrinogen level, which is responsible also in decreasing the viscosity of the blood. We have a multiple researches about this issue, and we found there is increased platelet, increased fibrinogen level, which causes stroke or causing cardiac attack. Another issue is nocturnal enuresis, which has a psychological problem to the patient, because it's psychologically unacceptable.
Of course.
Patient doesn't get comfortable sleep. He will awaken in the morning, feel depressed, psychologically upset, confusion, depression.
Of course, yes.
And this is a major problem to them. All of this is a complication of obstructive sleep apnea. So should be measured probably, and it's a simple measure. It's simple. It can be measured simply, inshallah.
Inshallah. So when somebody comes with treating sleep apnea, is not, or she's not just treating sleep apnea, they're also avoiding even more or major complications and problems that they would face or might face if they don't treat the sleep apnea. So when you diagnose the sleep apnea, what investigations that you would do to make sure this is the real diagnosis, and to be able to differentiate the causes of the sleep apnea?
Okay. First, as we said, from the symptoms and the signs, we can diagnose bronchial diagnosis of sleep apnea. But the key items in the investigation of sleep apnea is doing what's called polysomnography.
Polysomnography, that's, in other words, in simplified.
It's a simple device which we can measure everything which can happen during sleep. We can measure the stages of the sleep by drawing what's called electrocardiograph, EEG.
Yes.
We measure the changes in the heart by ECG, electrocardiogram.
Yes.
We monitor blood pressure during sleep, pulse changes for heart rate, and for sleep we measure what's called apnea. Well, as we said, it's a cessation of breathing by measuring the flow in the during sleep. Also, we measure the movement of the muscles, and you can measure also a lot of things.